This is a case of L5S1 disc herniation. On axial images, disc is on right side. So after initial bony decompression and after removing ligamentum flavum, now we are able to see dural sac and root, and there is a lot of adhesions by neovascularization. So these adhesions or these small vessels, these are coagulated and cut so that we can release traversing nerve root. So this is shoulder. Apparently this is a shoulder. This is traversing nerve root. So this is axilla. So when I was trying to medially retract this root, so I saw another root. There was suspicious root like structure, so I thought it may be another root or maybe it is exiting nerve root. So I decided to further delineate this structure so that I can see clearly what is this. So whether this is exiting root or this is some kind of anomaly. So then I used this diamond burr and decompressed it further. So ligamentum flavum was removed. So because on MRI there was no suspicion, so MRI was looking like normal or regular disc herniation, so there was nothing abnormal. So this was kind of incidental or incidental intraoperative finding. So clearly endoscopic spine technique has advantage here because it has angled vision so that we can see laterally clearly, and we can appreciate any abnormal structure, root or any another vessel or lateral recess clearly because of 20 to 15 to 20 degree lateral angle. So now you can see laterally we have decompressed it nicely. So now the next step is disc removal. So now again in such type of cases, my personal recommendation is that we should choose axillary approach because we cannot retract both the root medially, so it will put a lot of pressure on this conjoined nerve roots. So we have to choose axillary approach. We can go through both the axilla and we can take out all the disc material which is lying under the root or roots, and this axillary approach works very well in such type of situations. And these both the roots, conjoined nerve roots, are well protected, and it avoids undue pressure or traction on nerve root. So now you can see disc material is taken out from both the axilla and both under the both the nerve roots. So all the disc fragments are removed through both the axilla. Hemostasis is achieved. So now you can see this is nicely decompressed root. This is axilla, and now you can see both the roots are well decompressed, and lateral recess is also nicely decompressed. Thank you.